Good afternoon. My name is Nicole Purrazzo, and I'll be speaking about the naloxone liability exemptions bill. In the U.S., drug overdoses have doubled, if not tripled, since 1999. In 2013 alone, it is estimated that over 43,000 deaths were due to drug overdoses, and out of that, 16,000 were prescription opioid analgesics such as Norco or Vicodin. Many of these deaths are contributed by not being able to have access to reversal medication called naloxone, or better known as Narcan. In Illinois, the naloxone liability exemptions bill can help the state have more access to this medication and overall decrease the amount of deaths associated with heroin overdoses and opioid abuse. This bill allows any healthcare professional or bystander acting as a good Samaritan to have a standing order that can prescribe or dispense the opioid antidote naloxone. This medication order should be given to a person who could administer this drug under emergent conditions, or any person that is at risk at opioid overdose. Proper basic education and training would need to be given to these individuals in order to be given them immediate life-saving interventions to these people at risk of overdose. The law would allow for any first responder or third party, such as emergency medical technician, firefighter, or police officer, to be able to use this medication under life-saving interventions. If Illinois were to pass this bill, naloxone could help Illinois decrease their costs associated to the many deaths related to overdose. Case studies have shown that the success of this in various communities nationwide and worldwide, when given the availability of using naloxone in a third-party situation, came positive. For example, in Canada, there are supported venues for drug users to make sure they are in a safe environment while using and administering drugs to themselves. Personnel working at these facilities are allowed to administer naloxone in order to prevent any overdoses from happening. There were less occurrences of overdoses in these protected areas due to the safety that was provided and the availability of giving the medication Narcan. In another research study done in 19 communities in Massachusetts, they found that communities that participated in naloxone training programs had a lower opioid overdose rate versus other communities that did not enroll. They also had more education and understanding of opioid overdoses. Lastly, in the United Kingdom, a similar program initiated to train naloxone and administration of it also found consistent improvements in their communities with the management of opioid overdoses and are continuing to trial to have open access to this medication to the public. Overall, if passed, the naloxone liability exemptions bill could help healthcare in a significant way. It'll allow us to decrease opioid-related deaths and heroin overdoses. I am hoping that you will consider this bill and will take in consideration of all the case studies and information that was given in this presentation today. Thank you for your time.